Welcome to the Lighting Your Way podcast. This season, our sixth, we're talking to my colleagues at Guardian Nurses about how they help our patients navigate a very complex and confusing healthcare maze. At the end of each episode, you'll hear their suggestion as to how you can become an advocate for yourself and your loved ones. When you are struck with an acute illness that repeatedly causes you to go to the emergency room and be admitted, it might be time to find the right doctor. Unfortunately, finding a physician who cares, who is curious, who didn't graduate last in medical school, and who thinks outside the box is a little like finding a needle in a haystack. In this episode, my colleague Ramona Cooper shares a patient's story of apprehension and mistrust until the right doctor finally appears and listens. Welcome to the podcast, Ramona Cooper. It's good to have you. This is your first trip to the microphone?
Yes, it is. Thank you for having me, Betty.
Welcome aboard. You have been with Guardian Nurses, almost how many months? Almost a year, maybe?
January, it will be a year.
That's okay. Great. Time flies when you're having fun.
10 months, almost 11.
Who's counting?
I know.
And your role is a mobile care coordinator.
Yes.
And we have, I think, described that in previous podcasts, but tell me a little bit about what your role is.
So my role essentially is to outreach and help city workers, essentially to navigate the healthcare system, to kind of be their coach and guide, again, to, schedule appointments, identify providers, go with them to appointments if they request that, to, help ask questions, make sure their questions are answered. Help them kind of make informed decisions by giving and providing them with all of the information that they need.
Yep. And God knows people need it. So I'm happy that you're there. And you also visit them in the hospital.
We also do that as well, yes.
If they should be hospitalized, yes. So this is, so we're highlighting the work that our team does. And you had shared with me a compelling story about a patient that you had worked with. And I thought that we would talk about it today. So why don't you tee up that story for me?
Sure. So I met this member sometime in the beginning of the year, not long after starting. And she initially developed some respiratory symptoms, cough, shortness of breath, wheezing. Went to a local hospital who did not do anything really for her, just kind of like the bare minimum. Sent her home the next day in an ambulance, and she ended up right back in the hospital, different one this time.
Yeah. So did she go to the did she go to the ER there? Is that what she went to the ER?
She went to the ER, and this one was a little closer to her home, but she's kind of heard stories about this one, but was a little bit leery, but because of her symptoms, didn't want to be traveling too far. So that's the reason why she went to that one.
Okay.
But nonetheless, was not pleased, left the next day and ended up back in the emergency room of another hospital. With the same symptoms. So she has, frequented many times since then with pretty much the exact same symptoms, which are all fairly new to her.
Okay. I was going to ask this, has she had a respiratory issue before?
She has not, other than, just like some colds here and there. This has been pretty significant and extensive for her and, to say the least, very scary. Because, and for anybody who, can't breathe or is having trouble breathing, and to be in and out so frequently with nothing really resolved.
Yeah. Wow. So when did you meet her? What, like as a result of the visit to the hospital?
Yes, I met her as a result from the visit to the hospital. She initially was, kind of a little bit leery, but then opened up and, welcomed me in, to appointments with her. And I had visited her each time she's been in the hospital.
Wow. And how many times has that been? Has it been, I mean, this is early in the year, 2023. So how many
Yeah, this
admissions has
was
she had?
earlier in the year, so I want to say maybe from about March to April, it was 4 times, and then
Wow.
it kind of slowed down. And then it wasn't again until May, and then that was just one time, and then
Oh,
another time or twice from September to kind of up to date to now.
oh my gosh. Oh my gosh. And no one could figure out what was going on?
They gave her some explanations, but it still doesn't account for her symptoms, her continued symptoms, and the amount of times she's going to the emergency room. And just hearing her speak and, hearing the fear in her voice, it sounded like there was no other option except for her to go to the emergency room. When she's there, she gets the treatments, she gets medications. She stays maybe between 5 to 7 days. She does really good. She comes home for a while, and then the symptoms start back up again. So other than some mild restrictive lung disease, nothing definite past that. And she's had multiple tests, multiple imaging, pretty much all negative except for the restrictive lung disease, which is something that, again, she's never heard of having in her childhood and also, in her adulthood now.
Right. It just kind of came on her in the middle, just this year, just boom.
Absolutely. And it was after the encounter, like a brief conversation with someone who maybe coughed or breathed, and it was kind of downhill from there for her.
And wow. So this relationship that you've developed with her over time, you're going with her to the physicians, I assume pulmonologists, you're going to them, and no one can give her a definitive answer other than to say she has mildly restrictive lung disease?
Correct. Just recently, the most recent hospitalization, she did talk to a physician who gave her a lot more information that she has received all of this time. So it's a combination of about 4 different things that can be contributing to her symptoms. About 4 different things that be contributing to her symptoms that he did explain in detail. Okay. And it made a lot of sense after hearing that as to why she would continue to have these symptoms. So she was diagnosed with silent reflux, which over time, silent reflux, yes.
Oh. That's, you mean gastrointestinal reflux?
Yes, you have it. You don't necessarily have the symptoms per se of someone who has reflux where they have the heartburn and the belching, and she does not have all of those symptoms. So hers is considered silent, which over time can lead to or predispose you to chronic bronchitis, which the pulmonologist suggested that is something that is contributing to her continued symptoms.
Wow.
That along with OHS, which is something that I've never heard of. And then also one side of her diaphragm is a lot larger than the other one, and that could also be contributing to her symptoms.
What's I haven't heard of OHS either. Although that was my Olney High School. OHS, Olney High. Go ahead.
Yes, OHS. It's obesity hypoventilation syndrome.
Wow. Okay.
Yeah.
All right. So this woman's a little larger.
Yes, and it essentially makes you kind of breathe at a lower rate or slower rate than you normally would.
And then her diaphragm, which not controls,
Yes.
but which helps you to inflate your lungs, that
Yes.
isn't working equally on both sides. Is that what?
Correct. The right is about, excuse me, half the size of the left.
Wow. And they found that on
And I
CAT
felt
scan, or
that,
did they?
yeah, she's had CAT scan. Her most recent testing was a chest CT.
Okay.
But she's had these testings multiple times,
Right.
other than the chest CT, which was the last test. And I did recommend that she request that while she was at the hospital, because we talked about that sometime, and it was the only test that she hasn't had. But it was surprising to me to hear him tell her that after all of these months, and she's seen pulmonologists, and this one was the only one that could give her that piece of information.
Wow.
And what he essentially recommended to effectively treat it was surgery, which she is opposed to because of an incident that happened years before when she had to have abdominal surgery and ended in an emergent situation where her stomach had to be opened. She had a wound vac. So it really made her fearful of any type of, especially abdominal surgery.
What was the recommended surgery? So she's got a different sized diaphragm, right?
Mm-hmm.
She's got GERD or silent GERD. What would they do to correct the pulmonary issues?
It would be gastric bypass.
Okay. Mm-hmm. So to give her more room to breathe, essentially. Exactly. Less weight.
Yes.
Okay. Wow.
Yes. Mm-hmm.
Yeah, that's okay. That's a high risk surgery. Okay.
Mm-hmm.
Wow.
Yeah. And what anyone, of course, would be fearful of surgery. Period.
Correct. Yeah, but to your point, with all the testing that was done, and all the months of admissions and ER visits, very few physicians were able to, as I always say, be curious, right? That's one of our fundamentals. It's like, why does this woman keep coming to the ER, right? And let's look at the imaging. Let's look at her. Wow. So. Silent GERD. Did they put her on a PPI, a drug to minimize the symptoms of GERD, the acid?
Yes. So she's on 2. She did see an ENT doctor who kind of maximized those 2 medications.
Okay.
But I'll add another piece of information that I think could also be contributing to it is a diagnosis of OSA, obstructive sleep apnea, years ago, that has never been followed through. And also, although she does not have those symptoms that people with severe suffer from, where they wake up and they're gagging and short of breath, over time, what the pulmonologist explained to us was that can also affect you where you're suffering with daytime symptoms, coughing, wheezing, shortness of breath, feeling congested.
Wow.
And because of the apparatus, which, and from my experience too, I've never worn it, but to see patients with it and how uncomfortable they seem with them is the reason why she never followed through with it. But I think that is a big piece that's contributing to her symptoms. And speaking with the pulmonologist, he also agreed. So I just continue to encourage her to read up on that and to hopefully want to move forward with being retested and hopefully being able to use the current modern apparatus that people have today that is a lot more tolerable.
Yeah, I friend had just had OSA, and it's like a little pillow on your nose now. I mean, before it was like a big face mask and noisy, and kept your sleep partner up, and now it's like a little pillow that goes over your nose, and it's very quiet. But yeah,
Exactly.
that's
Yes.
wow. Well, it's like it feels like you just have to do one thing at a time, right? Because it's I always say sometimes it's like whack-a-mole, right? You get one thing fixed and then
Mhm.
something else pops up. So she's got other things going on. So I don't want to say baby steps, but right, you gotta okay, let's deal with your sleep apnea. Okay, now let's deal with your
Absolutely.
right. Wow. So do you
Absolutely.
feel
Yes.
at this point, so 10 months in, do you feel like she's on the right track now, thanks to somebody being curious?
I believe she is on the right track now. And I think this is the only doctor who's been able to kind of penetrate her sort of with the information and to be able to receive it.
Mm, okay.
With how he explained it and given all four of those different things that are kind of working together to cause her symptoms,
Right.
I think just the way that he approached her and his detailed explanation again was, I think, the point where she was able to kind of receive and say, you know what, that makes sense, because that was kind of the first time I heard her say that. All
Okay.
the other times was, no, 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 they don't know what they're talking about. I don't want to hear that. And I did not
Okay.
hear that from her from this
Oh,
time. So I think she received it well.
great.
And I think now that she is on the right track.
Good. And I mean, I think that's to your point. I think patients, they have to be receptive, and communication is a two-way street, right? So the physician finally, she met somebody who could explain it or present it in a way that was easy to understand and kind of factor all of it in. Like there's this, there's that, there's this, and all of it is
Absolutely.
contributing.
Yes.
Yeah. Wow.
Yes.
But
And he was very calm. He took his time, and he, excuse me, seemed very caring. And her experience in the hospital with the doctors were, they seemed to her dismissive of what she was saying and how
right,
she knew her body.
right.
And
Wow.
to explain to them, I don't think it's this. And she almost felt like, well, because they were doctors, you don't know what you're talking about.
Right.
We know, although you are explaining to us exactly what's going on with your body.
Right. Right.
And he didn't present that way to her.
Where did you go to medical school? Right. That's what, how many times have we heard
Exactly.
that? I mean,
Exactly.
physicians are dismissive, and I think one of the things that comes out of this story is that you as a patient have to, stand up for yourself and believe in what is happening to you.
Absolutely.
And you need to find a physician who's going to be curious and who wants to help, not just,
Yes.
oh, well, you're overweight and you have sleep apnea. So, no wonder you're not getting enough air. Right. And
Absolutely.
yeah.
Yes. Yeah.
Yeah.
So, I mean, and, it's unfortunate that it took so long to find that physician. I mean, because it's huge. You can run into, millions of doctors. It's just kind of like finding a needle in a haystack.
Right.
But she actually went back to the hospital that she went to the very first time where she didn't have a good experience.
Yeah.
And this is where the physician was who kind of tied it all in together for her.
Oh, there you go.
Mm-hmm.
Well,
Yeah. So
try
although
again.
she had a bad experience the first time, she ended up back there, and this time she just happened to see, or the right physician just happened to come and see her that day.
Well, and I also think you're probably not giving yourself enough credit that your support of her and your coaching her and kind of encouraging her and staying with her gave her probably the confidence to keep doing this, right?
Absolutely. Yes.
I think you're selling yourself a little short there, kiddo. So what do you think, like when you think about, there's a lot to the story in terms of believing in your, knowing how many times have we said you have to meet the patient where they're at? It sounds like nobody did that until she met this pulmonologist. Yeah. Be curious. All the, not all, but some of the fundamentals that we talk and practice at Guardian Nurses seem to come into the story. So What would you like though for lay people that are listening, someone who doesn't have a Ramona Cooper by their side to encourage them and coach them and say, nope, you deserve better. You should be treated with the whole person, So what would you like to encourage people as a takeaway to do?
I would say for people to learn their rights and responsibilities, to speak up, to use your voice, to take an active role, in improving their own life, to kind of be just self-aware, understand what your needs are, what kind of support and help that you might need, try to prioritize your concerns and, recognize if it's something that you don't agree with the physician, to speak up, to take notes, always write things down, especially names and dates, medications, because all of that medical jargon can, just be very confusing. So write things down, do research, bring someone with you, always have a second set of ears, be honest, ask follow-up questions. You're worried about something that you don't understand, what can be done? Can you help me to better understand it? Are there other options? Will my insurance cover this? Why are these tests and appointments necessary? Ask about results and, how they're monitored and how they'll be delivered to you. Find support, learn as much as you can and just kind of understand the follow-up plan. And again, like I speak up, ask, and ask again until it's something that you understand.
Well, it sounds like she, probably did all those with your support. And also, I mean, she was working full time, right?
Absolutely. Yeah. Which was another stressor in itself, with a supervisor and reaching out to her sooner than she needed to for, paperwork. And that was a whole other issue for her that was kind of stressful as well, that played into it. So
the stress of not knowing what you have, right? Because she probably went to the dark side, thinks she has cancer or something, right? Because nobody can find it. Something's in there. Something's going on that's causing me to be sick. So
exactly.
Yeah, I mean the stress of just not knowing plays a role too. But it's so difficult, which is of course why Guardian Nurses is around. It's so difficult to manage the healthcare system, particularly when you're not being diagnosed or easily, I guess, not easily, but, quickly perhaps, and able to get a treatment plan in place. So she's sticking with this pulmonologist, I hope.
She is. She did not want to at first, but, after our brief conversations, she decided to stick with him. And I think that she'll be making a lot more progress with going to him.
Well, Ramona, why didn't she want to stick with him after he not found out, but finally?
Well, because he's a part of the hospital that she originally went to, yes, and did not want to continue back there. But I said, although he's a part of that, he is a physician who gave you a significant amount of information that nobody else could seem to give you or find all of these months in. And here he is. And, he was able to just, within that brief time that you were under his care, to see all of that with your notes, the testing, and to give you a much bigger picture. So she did, after, like I said, a couple of conversations, agree to continue to see him.
Whew. Okay, good work. I don't want her to start over with anybody else who's not paying attention, right? Jeez.
Yeah, absolutely.
So, thank you. I think these stories, of our nurses in action are reminders for all of us that you know your body just as better than anybody, and you should, if you didn't have a Ramona Cooper by your side, you should absolutely believe that you deserve to have good care.
Oh, thank you so much, Betty. Yes, everybody deserves good care, if not the best.
Right on. All right. Thank you, Ramona, for joining us. I hope you come back for a second.
Thank you so much for having
guest
me.
appearance.
Absolutely, I will.
All right. Take care.
I enjoyed our conversation. You too. Have a great day.
Okay. Bye-bye.
Bye-bye.
If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. That email again is podcast@guardiannurses.com. We would love to hear from you. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.